Ourselves. I'm Tibisay Zea, tonight on Greater Boston. As the nation confronts yet another spate of mass shootings, we'll hear from the people behind a new Boston-based initiative. Then later, I'll be joined by Dr. Joseph Betancourt, the new president of the Commonwealth Fund, on how he plans to tackle racial and economic disparities in healthcare. The U.S. is known for its high rates of gun deaths, but the past week in particular has been especially violent. Saturday, a gunman opened fire in Monterey Park, California, killing 11 people celebrating the Lunar New Year. 2 days later, on Monday, another gunman in California shot and killed 7 people in Half Moon Bay. Around the same time, a man in Des Moines, Iowa, opened fire at an educational program for at-risk youth, killing 2 students. And yesterday, a man shot and killed 3 people near a convenience store in Washington state. 4 mass shootings in 5 days. And those are just the ones that have gotten widespread media attention. Tens of thousands of Americans are killed by guns every year, and all of them leave behind friends, families, and communities that are forever changed by their loss. Here in Boston, one local group is working to draw attention to their stories, putting the focus on the people fighting to overcome grief and interrupt the cycles of violence. The Engagement Lab at Emerson College has partnered with the Louis D. Brown Peace Institute and the Gun Violence Prevention Center at Mass General Hospital for a 3-year initiative called Transforming Narratives of Gun Violence. I'm joined now by the director of the Engagement Lab, Gordon and Janice Johnson, Healing Support Services Manager for the Louis D. Brown Peace Institute. Janice, thank you so much for being here with us. So why don't you tell us a little bit about this initiative? What is it about?
Well, I can start. Transforming Narratives of Gun Violence, we started it about a year ago, actually. It's about centering voices of people who have often been excluded from stories of gun violence in our city, and doing so by creating context for collaboration between communities and Emerson College students and faculty. And ultimately, what we're trying to do is we're trying to create new stories. We're trying to elevate stories that are already being told, but that are not being listened to. And we're trying to co-create possible futures and thinking beyond the gun, thinking towards what peace in Boston looks like, and doing that through different kinds of storytelling.
So this initiative is called Transforming Narratives on Gun Violence. Janice, so why don't you tell us, what are some of the messages or narratives that you think are hurting some neighborhoods or communities in Boston?
Yes, thank you. And just starting off by hearing gun violence, gun violence, gun violence. The gun. We want to promote cycles of peace, cycles of healing. Those are the narratives that we want to put out. Through our 7 principles of peace that we embody at the Peace Institute: love, unity, faith, hope, courage, justice, and forgiveness. And with those principles, we would like that narrative changed, because the more you hear about the gun and violence, those are the narratives that stay in our heart. Those are the narratives that stay in our brain. So we want our principles, the 7 principles, we want that narrative in our communities.
So Boston, has one of the lowest gun death rates in the U.S., and it is often looked to as an example of gun control and prevention. But for those who live in neighborhoods, like Dorchester, Roxbury, Mattapan, there is a different story. Actually, there have been more than 700 shootings in Boston in the last 4 years, and 75% of them happened in these neighborhoods. So we would like to hear from mothers of mothers who have lost their kids
You're not just dealing with the loss of your child, you're dealing with how people treat you. Like when my son was taken, they tried to say he was a gangbanger, he was this, he was that.
There were no resources whatsoever for me or my family to navigate this journey.
Because I always say, he was my child. He wasn't no saint, but that was my child.
So we're not just dealing with the loss of our kid, we're dealing with people judgment and saying things and just being negative and evil. And it's like we're the victims, but we're getting treated like we the perpetrators.
And I knew my child's life mattered, but I was still suffering in silence based on society, based on how I felt like he was still being re-victimized in death.
The clip that you just showed is from the film Quiet Rooms that was created by a collaboration between students at Emerson College and mothers who have lost their sons to gun violence in this city, who sat in the class with our students for the entirety of the semester to create that film. What the stories that you hear are not just documentary filmmakers interviewing someone and getting stories from them. This is a collaboration in the sense that for the mothers that were participating in that class, this was about the story that they wanted to tell. And for the Emerson students, it was about being alongside those mothers so that they can tell that story. So the way that we work is by facilitating those connections, by bringing people together who may have very different life experiences so that they can co-create something by allowing skills and experiences to meet with other skills and experiences so we can get stories like what you saw in Quiet Rooms. And for example, we're doing another class this semester in collaboration with another organization called Boston Uncornered. And in this case, we're dealing with men who in most cases are or have been perpetrators of what we might call perpetrators, and bringing them into the classroom to tell stories of peace and to tell stories of healing. And so it really is about bringing people together. And Janice, Janice also partnered with a class last semester working alongside those students. And I'll leave that to Janice to talk about.
Yes. And we worked on a project called Virtual Peace Play. So at the Peace Institute, we have a healing technique called Peace Play in urban setting. And this technique brings families, individuals, and communities together. And we invite them to reflect on their struggles and strengths by placing miniatures in a tray of scenes. And they create scenes that they would like to speak about and talk about through words that they may not have language for because of their trauma in their lives. You talked a little bit about the perpetrator or the survivor working together. And I really wouldn't say that survivors and perpetrators work together. We build relationships through families. At the Peace Institute, we also have a program through reentry. So we connect survivors through reentry because we are on both sides. Our survivors are on both sides. We may have someone who's incarcerated, and we may have someone who have been murdered. So we do bring those two groups together through the family dynamic, not through the incarcerated person themselves.
So you are teaching journalism students about, media narratives on gun violence. What is the narrative that you are hoping these students will bring when they become professional journalists?
Well, I'll say we're teaching more than just journalists. We are teaching journalists, or aspiring journalists, but we're also teaching filmmakers and theater artists and media artists, and we're teaching all sorts of storytellers. And we want to see this as not just professional journalism, but we want to understand storytelling in new ways. And so let me go back to your question about journalism. The problem right now is one of the problems is that what gets reported on is the incident, the gun, the death, the crime. What doesn't get reported on is all of the harm that persists after after that incident. The cameras go away, the reporters go away, and community harm persists. Those are the stories that, you know, like Miss Janice here, who I've learned so much from, and just in my time working with the Peace Institute and everyone at the Peace Institute, learning about those stories and figuring out ways to elevate those stories so that the news cycle isn't so short, and then we can begin to heal as a city by understanding gun violence as more than just a series of incidents. And we can get rid of this narrative, as you've already mentioned, that Boston is the safest city and the safest state, because for so many people, that's not the case. And so we need to bring those stories to the center of those people who are perpetually dealing with this harm, and are seeking to heal. And storytelling is a way to do that. And the Emerson and the facilities and the skill set that we bring to the table is, as I see it, as a strategic partnership with so many people in the city to make that change happen.
Yeah,
absolutely. And hearing the narrative is about healing, and the conversations, just hearing, you know, about the violence and what's going on in other cities and what is going on in Boston. In the media, like now, we should be talking about how do we have these cycles and cultivate cycles of peace in the healing process. Like, what is the healing process? What is the healing process through the Louis D. Brown Peace Institute, you know, that I would like to talk about? The healing group, survivors in the community need healing within. Healing within, and a place to go for the healing, and to know through the media that the healing exists, these places exist. When we hear about gun violence, the narrative and the change of the narrative is you have this place to go to. The Louis D. Brown Peace Institute exists. These partnerships exist for you to begin your healing journey, or maybe to even help someone else through theirs. Because when a homicide happens, 10 family members are impacted, and the schools are impacted. The whole community is impacted. So we have to change the narrative and say healing happens.
You have also partnered with the Gun Violence Prevention Center at Mass General Hospital. And we would like to hear from one of the doctors who is part of this initiative as well.
The only people that know how this message is delivered are the people who deliver it and the people who receive it. What we thought that we needed to say is, here's the reality of our lives that we do, 40,000 times a year in the United States, at least. It's a horrible place to be, to give the news after you've worked on a child for half an hour that doesn't survive a gunshot. And you're giving the news to a parent who's leaving the hospital without a child. And you're never going to see that person again.
There's a very specific sound that a mother makes when you tell her her child is dead. And that sound sticks with you forever.
What role does the Gun Violence Prevention Center at Mass General Hospital play in this initiative?
Absolutely a central role. So the partnership started with Mass General Hospital, Emerson College, and the Peace Institute. And this triangulation here is really, really important. Mass General Hospital, the Center for Gun Violence Prevention, they're seeking, they're building the research body, the medical research body on gun violence as a public health crisis, gun violence as a health issue. They wanted to work with us because they understand that the way that we tell stories impacts health. They want to work with us because they understand that the community participation, the bringing people front and center into that transformation is absolutely necessary for the transformation of the health field. And so having Mass General Hospital as part of this partnership suggests that within the larger health community, there is a desire to change the narrative our health institutions, our medical institutions are cultivating, right? That bringing community voices into our medical establishment is actually something that they care about and are investing in. And the hope that I see not only from our partners at the Mass General Hospital at the Center for Gun Violence Prevention, but also at the violence prevention units